Hi everyone, Dr. Ian here from Sprouting Health Chiropractic. So, do you know anyone who has suffered from low back pain? Now, it is actually one of the most common cause of disability worldwide, and also 80% of the population worldwide would have at some stage experienced low back pain. Now, there are many reasons for that, but the one that I'm going to talk to you about today is lumbar disc herniation. It is one of the most common cause of low back pain. Now, let's talk a little bit first about the spine and how it all comes about. So basically, as you can see, within the whole spine, between the vertebrae, there are discs. Now, there are two things within the disc. So in the middle of it, it's a bit like liquid, and on the outside of the disc is a little bit like fibrous and tough tissues. Over time, as you go about daily activities, as you go about work-related activities or sport, and so a lot of mechanical stress happening throughout your life, and if it's accompanied with a poor alignment or poor biomechanics, it can degenerate. Now, one of the things that can happen is that the structure of the disc will get compromised, and as a result of that, the liquid bit in the middle will start poking out and pushing out. So what happens is that then there is a herniation process happening, and so the disc will start poking out a little bit towards the back usually, because that's the easiest path. And when we sit down or when we're inactive, usually we bend our spine this way on, so the back part opens up a bit more and it will hit on the nerve and you start feeling pain and different symptoms. The common symptoms to look out for is not just localized back pain, but maybe sometimes a pain going to your glute area, or maybe going down one-sided towards the hamstrings, towards behind the knee, and so on. Or maybe it can be worsened when you start sneezing, when you go to the toilet, when you suddenly cough and things like that, and you just feel that sharp pain and radiates down. So, can chiropractic care help with that? Yes, it can, because it is one of the common conditions that we see here in the clinic. And also there's one of the current research, the latest one, there is a study done where they study a group of 18 to 49-year-old patients who are recently diagnosed with lumbar disc herniation, and comparing chiropractic care and with other care. Now, it's a retrospective study, which means that they follow up over a year and over the period of 2 years. So basically, the group of people who sees chiropractic care over the period of those 2 years, and they look back, there is a less chance of them having the need to have a more invasive procedure, such as a discectomy or a removal of the disc that is sticking out, that's hitting on the nerves, that's causing the symptoms. So yeah, so that is a promising thing. So if you or anyone else, your loved ones is suffering from back pain and have had some of those symptoms that's commonly associated with disc herniation, why don't you give us a call and let us help you, and let us look into it so that we can help you out and get back to your daily activities and functioning as best as you could. So, all right, thank you for listening in. Hope to see you again next time. Please take care. Bye.